to Miriam, feel free to put comments or questions in the chat, and then we'll have some time for that at the end of the session. So yeah, you can take it away, Miriam.
Okay. Hi everyone, my name is Miriam Pujo, and as Ashley introduced me, today I'll be taking you on my thesis work, and sorry I will be off camera because of the internet. So my work is titled Trends and Predictors of Prolonged Length of Hospital Stay among surgically treated orthopedic trauma patients in a tertiary hospital in North Tanzania from August 2020 to March 2025. So these ones will be my outlines, and for the definition of key terms, length of hospital stay will be defined as a total length of time that a patient stays in the hospital for the purpose of treatment, which is measured as an interval, usually in days, and it will be measured from admission to discharge or death. And prolonged length of hospital stay, as defined, it will be length of hospital stay above the 75th percentile of the entire study population. And orthopedic trauma will be defined as orthopedic, for my case, it will be defined as trauma due to external forces, and for my case, it will be fractures. So for the introduction, globally, 4.4 million deaths occur due to injuries, and 7.89 trillion USD is expected to be lost from trauma care in the year 2025, 2015, 2030, and length of hospital stay as used is an important measure of health system efficacy. And in the low middle income countries, this is where more than 90% of all injuries happen, and greater than 50% higher economic losses are expected in these countries as compared to high income countries. And in these countries, 1 billion people are hospitalized each year for treatment of an injury. And in Tanzania, there have been a 36% growth of orthopedic burden from 2015 to 2018. So for the high income countries, this including USA, UK, and Canada, the mean length of hospital stay in studies that are conducted in these countries have shown a mean length of hospital stay of 3 to 9 days, while in Australia, where prolonged length of hospital stay was taken as greater than 14 days, length of hospital stay greater than 14 days, they estimated that 9.7% suffered prolonged length of hospital stay. In low and middle income countries such as India, the mean length of hospital stay, as reported by studies among orthopedic patients, was 10.5 days. And in Ethiopia, where studies have been conducted regarding prolonged length of hospital stay, it has been shown that 25.3 to 26.5% of patients suffer from prolonged length of hospital stay. And in Nigeria, where they took prolonged length of hospital stay as greater than 7 days, 63% of them suffered from prolonged length of hospital stay. So we see that still low and middle income countries, they have a higher cutoff point of prolonged length of hospital stay, but they still have quite a higher burden of prolonged length of hospital stay as compared to high income countries. So in Tanzania, for KSMC, we don't really have studies that have looked at prolonged length of hospital stay, but for length of hospital stay per se, we have two studies that have been conducted in KSMC, where a study that was done among trauma patients showed that the mean length of hospital stay was 6.1 for trauma patients, and another study that was done for patients who had orthopedic diseases showed that the mean length of stay for these patients was 13.5 days. So we have limited data on prolonged length of hospital stay among orthopedic trauma patients and their predictors, and understanding these predictors can help improve care among these patients. So my problem statement. So orthopedic trauma patients as I had said initially, is a major cause of hospital admissions, and likely these patients will require surgical care. And prolonged length of hospital stay after surgery and before surgery is commonly cause multiple challenges, as it increases direct and indirect costs for patients and families, and it causes hospital overcrowding, limiting bed availability in a already constrained setting. Prolonged length of hospital stay increases the risk of complications such as hospital-acquired infection and pressure ulcers, and there are limited evidence on what drives this long hospital stay in low-middle income settings. So my study justification, this study will guide better planning in orthopedic trauma care. That will lead to reduced financial hardships for patients or families, improve hospital bed capacity, and avoidable medical complications. It will also help in understanding predictors of prolonged length of hospital stay, which is key in informing discharge planning, streamlining perioperative care, and supporting targeted interventions. So for my study objectives, my broad objective was to determine trends and predictors of prolonged length of hospital stay among surgically treated orthopedic trauma patients in a tertiary hospital in northern Tanzania from August 2020 to March 2025, with my specific objectives being to determine the proportion of the prolonged length of hospital stay, 2, to describe the trends of the prolonged length of hospital stay among these patients, and 3rd was to identify predictors that are associated with prolonged length of hospital stay among this group. So for the methodology, my study design was a retrospective cohort study. My data source was the KSMC Trauma Registry from 2020 to 2025. My study area was the KSMC Zonal Referral Hospital, with my study population being orthopedic trauma patients treated surgically from 2020 to 2025, with my inclusion criteria being patients with fractures and who have underwent surgery who are greater than or equal to 18 years, and data cleaning and analysis has been done by our statistical software version 4.4.3. So my independent variables, I have the sociodemographic characteristics like age, sex, education, place of residence, and insurance status. For the admission characteristics, I have the admission time and referral status. And for the clinical characteristics, I have injury location, number of surgeries, complications, comorbidities, substance, and injury severity. So my dependent variable was prolonged length of hospital stay, but this was obtained from length of hospital stay, which was obtained by taking a date of discharge or death minus date of admission. And prolonged length of hospital stay, as I said initially, it was taken as patients above the 75th percentile of the length of hospital stay of the entire study population. So for the first and second objective, they're descriptive statistics, where continuous variables have been measured by mean or median and using a standard deviation interquartile range. And for the predictors, I use the modified Poisson regression. So the results. The registry had a total of 4,013 patients after excluding patients with fractures and patients who did not undergo surgery. I remained with 1,471 patients, and of these I excluded patients who did not have a discharge or admission date or a death date, and these were 6 patients, and I remained with 1,465 patients. So for my analysis, I used the 1,465 patients. So this is a figure showing the proportion of length of hospital stay, prolonged length of hospital stay among surgically treated, where we see 24.8% had prolonged length of hospital stay, and for those 75.2 had normal length of hospital stay, And for prolonged length of hospital stay, this was 27 days or above. And we had 27 to 369 days and a median of 42 days in the group of prolonged length of hospital stay. So for the table 1, social demographic table, so we see a length of stay was 11, they had a median of 11 days with the interquartile range of 6 and 26 to 26. And age, we had most patients, the median age was 36 years with the interquartile range of 26 to 51 years. Most patients were males, and most of them had non-formal employment, with most of them having having primary education. So for the marital status, most patients, more than half, were married or cohabiting, with a majority, which is 84.6%, not having national health insurance, and quite a high number, which is almost 24%, had used substance in the last 6 hours before the accident. So for the admission-related characteristics, we have there was no the patients that came within the day and during the night were almost similar, with a majority of patients being referrals, which is 85.3%, and most of them had no comorbidities. And for comorbidities, this is hypertension, diabetes, and HIV. And majority of patients did not develop complications in the course of treatment at KSMC, which is 95.1. So most patients were alive at the end of the study period, and most patients had mild trauma as defined by the KTS injury severity score, and most patients underwent only one surgery, which is this 86.3%. So for table 3, this is the comparison of characteristics, and we see that there was a difference between the two groups who with a normal length of stay and the prolonged length of stay among patients with among the National Health Insurance group, KTS injury severity group, complications, those who underwent surgery, more than one surgery and more than one surgery, the injury location, and timing to surgery. So for the trends, we see that there was an increased trend of the proportion of prolonged length of hospital stay from 2021 to 2024. This shows that maybe there might be an increasing severity of cases over time. And another thing that can explain this increasing trends could be the challenges in the pathway in trauma care that leads to delay, which later leads to prolonged length of hospital stay. So for the univariate and multivariate analysis using univariable and multivariable analysis using modified Poisson regression, we see that those who had national health insurance, they had a 26% lower prevalence of prolonged length of hospital stay compared to those who did not have national health insurance. Those with moderate had a 46% higher prevalence of prolonged length of hospital stay compared to those with mild, and those with severe had a 45% higher prevalence of prolonged length of hospital stay compared to those with mild injuries, but this was not statistically significant. For the complications, those with complications had almost two times higher prevalence of prolonged length of hospital stay compared to those who did not have any complications. And for those who underwent more than one surgery, they had almost 3 times higher higher prevalence of length of hospital stay compared to those who had only one surgery. And for those who had upper extremity injury, they had a 56% lower prevalence of length of hospital stay compared to those who had lower extremity injuries. And those who had injury in the thorax, they had a 58% higher prevalence of length of hospital stay compared to those with lower extremity injury. And those who had neck injury, they had 80% higher length of hospital stay compared to those who had lower extremity injuries. But this, all of them were statistically significant. And for the timing from injury to surgery, we see those who underwent surgery 24 to 48 hours had a 14% higher prevalence of prolonged length of hospital stay as compared to those who had surgery within 24 hours, but this was not statistically significant. And for those who had surgery performed greater than 48 hours from injury to surgery, they had a 32% higher prevalence of prolonged length of hospital stay as compared to those who had surgery within 24 hours, and this was statistically significant. Other variables were not checked in the multivariate analysis, considering that they had a p-value greater than 0.2, and the studies, most studies did not include them in they had no scientific vigor in the adjusted models in other studies that were done. So for the discussion, the median length of hospital stay, as I showed, it was 11 days. So this is similar to studies that have been done, especially in the low and middle income countries, where a study done in India showed median length of hospital stay being 10.5 days, and another study done in Nigeria also showed 11 days. This is contrary to the high-income countries, where we see that the median length of hospital stay is quite lower, ranging from 3 to 9 days. And as we saw the trends of prolonged length of hospital stay, these trends have been increasing from 2021 to 2024, with 18% in 2021 to 38% in 2024. And the possible reasons for the increase in trend will be an increase in the survival of severely injured patients due to better in-hospital trauma care. Another reason could be due to the decrease in the socioeconomic status. There could be delays that could happen, leading to prolonged length of hospital stay. This is as shown in other studies that have looked at the relationship between socioeconomic status and prolonged length of hospital stay. Also, over the years, there have been an expansion in the surgical capacity at KSMC, as initially the proximal femur fixations were not done at KSMC, so patients were either referred to Muhimbili Orthopaedic Institute, MOI, or other areas. And thereby, over the years, because we are increasing surgical capacity, patients with severe injuries tend to stay longer. Another thing was those who underwent surgery greater than 48 hours had a higher length of hospital stay, and this has been shown in also other studies where patients who underwent surgery more than 48 hours had poor outcomes, including length of hospital stay. For insurance, patients who were insured had lower prevalence of prolonged length of hospital stay. This could be due to faster investigations, treatment, and discharge, as shown also in other studies. And for complications and surgeries, both who had complications and who had multiple surgeries had increased prevalence of prolonged length of hospital stay. This has been shown also in other studies. For injury severity, patients with moderate to severe had higher length of hospital stay as compared to those who had mild injuries. But for severe injuries, we saw that it was not statistically significant. So this can be explained first in our study population. Only 1.1% had severe injuries, and due to the small proportion of people we had, this could be due to less power, and but also why do we have few severe patients? This could be due to increased early mortality in severe cases, and also there is low pre-hospital survival, and studies have shown up to 40% of trauma patients die on scene. So this could be the reason. And for anatomical site, those who had injuries in the neck, chest, and the back, they had higher length of hospital stay. This could be due to the vital organs that are in these areas, and also surgeries involving these areas. Let's say the neck, there is the spine, so this could lead to low mobility, leading to higher prevalence of prolonged length of hospital stay. For those who had upper limb injuries, they had low prevalence of prolonged length of hospital stay. This could be due to increased mobility in these patients, and this could necessitate early discharge, as it has been shown in other studies. So for my study strength, this study focused on surgically treated orthopedic trauma patients, and as it narrowed these patients to only surgically treated orthopedic trauma patients, there have been an increase in the clinical relevance, and as since Tanzania is developing, and we have seen that there have been surgical capacities that have been done in most areas. So we are expecting that most trauma patients in coming years will not be treated conservatively, but will be treated surgically. So this study will help to reduce the prolonged length of hospital stay. And this study also showed a 4-year trend analysis. This has helped, because over the time it has helped to capture hospital capacity, workforce, and care, and this will also support planning and system improvement. For the limitation, this was a retrospective design, so there was a risk of missing or misclassifying data, and also we had no data on pre-hospital delays or post-discharge outcomes, and we had lack of clinical predictors such as hemoglobin level, CRP, and creatinine levels. So for conclusions, we have seen an increased trend in the prolonged length of hospital stay over the 4 years. And the key predictors for prolonged length of hospital stay were surgery greater than 48 hours, injury severity, complications, anatomical injury site, multiple surgeries, and lack of insurance. Highlights of the importance here are to ensure timely surgical interventions, expand health insurance coverage, and strengthening hospital capacity and surgical scheduling. So for the recommendations, one is to ensure timely surgical interventions, that is within 24 hours, to reduce length of hospital stay and improve outcomes. 2 is expand access to quality care through insurance, so promote national health insurance and reduce disparities in length of hospital stay. 3 is reduce post-surgical complications. This can be implemented by daily multidisciplinary rounds and adapting the enhanced recovery after surgery protocol, which will accelerate recovery and minimize complications. So these were my references and my acknowledgements, and thank you for listening.